Hi, my name is Deanna Harris, and this video is for Nursing 224. This is for the insertion and removal of the indwelling catheter. So I will come in, I will introduce myself to the patient. Hi, my name is Deanna. I'll be your nurse for today. Can you please state your name and your date of birth? Okay, great. So I'm just here to verify the order from the provider to insert the catheter. The the catheter. Are you allergic to any latex, shellfish, chlorhexidine, or iodine? No, great. So then I'll go ahead and provide privacy for the patient. I'll go ahead and get my supplies and put them on a clean surface. And then I will perform hand hygiene. I'll inform the patient the rationale for why we're inserting the catheter, why we're going to remove the catheter. I'll answer any questions that the patient may have and also obtain a verbal order from the patient. And then I'll go ahead and clean the perineal area. I'll raise the bed up to the level of my hips or my comfortability. Then I will assess the patient for any bladder distension, perineal redness, skin breakdown in the area, rashes, or open sores. So then I'll also position the patient in a supine position with their knees flexed, and I'll ask the patient to move their ankles up and to the side, drop their knees. I'll also perform hand hygiene, and then I'll lower the side of the rail that I'm working on. And since I'm right-handed, I'll go ahead and position, stand on the right side. And then I'll remove the kit from the bag here. Being careful to start with it being away from me. So I'll open away, side, side. Being careful just to touch the 1-inch, the borders. Then I'll go ahead and carefully grab the drape and place the drape over my patient. And then once I place my drape, then I'll grab my gloves and then I'll don my gloves. Being careful to just touch the borders. Grab the cuff. And then hitchhiker thumb and grab here. Then I will go ahead and place this in the proper reciprocal. My left hand will be my dirty hand, and my right hand will be my sterile hand. So I will then move the kit close to my patient, underneath my patient here. Okay. And then once I do that, I will inform the patient that I'm going to touch the perineal area. And I will then, I could also go ahead and put the fenestrated drape upon them in the perineal area. And I can just gently cover them, or cover that area. And then I will go ahead and set up my kit here. I'll go ahead and take my iodine plate and squirt it all over the cotton balls here. And I can throw that in the reciprocal, in the trash. And then I can go ahead and take my sterile, my lubricant, and put that in my container here. And then I will take the sterile water here and attach it to the port. Let's see the port here. And then there. And then next thing I will do is I will go ahead and take the cover off of the actual catheter, being careful to control it because we want it to remain in our sterile field. Okay, so now since we have done that, it's in the sterile field. Now I will take the patient's labia and open it so I can clean it. So I will then take a cotton ball and do the furthest away from me first and dispose. Closest to me, discard, and right in the middle. Now once I have done that, after I've done that, I can take the tip of my catheter, go ahead and get some lubrication on it, and then go ahead and start to insert. Being careful not to touch the dirty hand with my sterile hand. And once I have inserted, if I see urine, I go ahead and do an extra 2 inches before I fill the balloon. So then I can release the labia and hold the catheter with my left hand and go ahead and fill the balloon with 10 cc's of the sterile water. I can then, once I do that, I can inflate it, and I will gently pull down or tug it down to be at the base of the bladder. So once I do that, I can go ahead and remove my sterile gloves, and then I'll go ahead and put those in the trash, and then I will go ahead and clean up and put everything in the trash. I will take these off, and then I'll just put on some clean gloves and then throw them in the trash. Clean up and throw everything in the trash. Once I throw everything in the trash, I'll go ahead and raise the side rail, perform hand hygiene again after I take those gloves off, and then I'll secure the catheter to the patient's thigh and with the tape, and then I attach the bag to a non-movable portion of the bed, a stable part to the bed, being careful that there are no loops, so the gravity can take the urine directly into the bag. I will let the patient know that that I have cleaned the perineal area thoroughly, and I will, adjust the patient, make sure that they're comfortable. To remove the catheter, I will inform the patient that I'm going to go ahead and remove the catheter. I will inform the patient that that I'm going to expose them. So I'll lift the gown up, and then I'll assess for redness, rashes, and any open sores. So then I will also place a drape underneath them, so if when I pull the catheter out, if there's any dribble from the catheter, that it can get on the the drape. Then I will I will I will go ahead and don gloves on. I'll go ahead and perform hand hygiene and don clean gloves. And then I will go ahead and drain the catheter, and I'll observe the catheter for any blood, any mucus, any signs of infection that's in the urine. And then I will go ahead and remove my gloves, and then put the side rail up, and then I'll perform hand hygiene again. I'll put more clean gloves on. And then I'll put sterile gloves on. And then I will go ahead and attach the syringe to the empty syringe to the balloon portion, and it should just suction it right out. Once that is suctioned out, then I can take the syringe, I can take the catheter, and I'll let the patient know that we're going to remove the catheter slowly and take some deep breaths. So I will slowly remove the catheter, and I'll assess the catheter for any blood or mucus. And then I can remove the gloves, and I'll perform hand hygiene. I'll put on new gloves, go ahead and clean up my area. I'll go ahead and raise the side rail. I'll take off, once I put everything away, I'll take off the gloves and put them in the trash reciprocal and perform hand hygiene. I'll lower the bed into the lowest position, make sure that the bed is locked, and that the call light is in reach. I'll perform hand hygiene. I'll do my aided, and answer any questions that the patient may have, and then I'll leave the room. Thank you.